Hello and welcome to our pksim online tutorial series. Please be reminded that the results of the checkmarked videos are necessary to be able to follow the content of this video properly. In this video, we will show you how to create a compound. By taking the example of midazolam, we will explain how to add physicochemical properties of your compound, a metabolizing enzyme, and a renal clearance process in pksim. To create a compound, right-click on Compounds in the Building Block Explorer and choose Add Compound. Enter a name for your compound. In the tab Basic Physicochemistry, you can define physicochemical properties of your compound. Parameters marked with a red cross, like lipophilicity, fraction unbound, molecular weight, and solubility, must be entered as they are used to calculate, for example, the intestinal permeability or partition between red blood cells and plasma. You can rename your entry by clicking on the three dots or add more parameter values by clicking on the plus symbol. A small molecule is predefined. If you want to create a large molecule, like an antibody, remove tick in the checkbox. The first parameter is lipophilicity, where you can enter a log P value. For our example compound, midazolam, enter a log P value of 3.13. The second parameter is plasma protein binding. A plasma protein binding to albumin is predefined. You can also choose between alpha-1 acid glycoprotein and unknown if you don't know the binding partner of your compound. Enter a value of 1.6 for fraction unbound and choose % as unit in the drop-down menu. The next parameter to specify your compound is the molecular weight. Enter the molecular weight of midazolam, 325.77 gram per mole. If your molecule contains halogens, this has to be defined in the drop-down menu as halogens, where you can enter the number of chlorine, fluorine, iodine, and bromine atoms of your compound. For midazolam, add 1 chlorine and 1 fluorine. To close the window, click Cancel. Next, you can choose the compound type. That means if your compound is neutral, has acidic or basic groups. If you choose acid or base, you can enter a pKa value. If necessary, you can add more than one pKa value. For our example midazolam, select base and enter a pKa value of 6.15. Drug solubility at different pH values can be entered in the lower part. Enter the solubility 49 mg per liter for midazolam. Change the pH value to 6.5. Press Return key and click Next. The next tab, ADME, now opens. Here you can define parameters describing absorption, distribution, metabolism, and excretion of your drug, as well as relevant inhibition and induction parameters. In the menu bar Absorption, select Specific Intestinal Permeability. Calculated values depend on log P and molecular weight. You can see the value if you click on Show Values. Choose Plus to add a new entry. This is necessary if specific intestinal permeability has to be optimized. Name the new entry Optimized and click OK. Enter a value of 1.88 e to the power of -4. Next, select Distribution Calculation. Here you can choose the calculation method. There are different methods predefined in pksim for the calculation of organ plasma partition coefficients or cellular permeability to calculate permeability parameters for barriers between interstitial and intracellular space. Different methods can be selected in the drop-down menu. If you want to optimize organ permeability, the same procedure as for specific intestinal permeability can be used. Select the partition coefficients calculation method Rogers and Rowland. If your compound shows target-mediated drug disposition, you can add the corresponding protein binding partner in the menu bar Distribution. To add a metabolizing enzyme, right-click on Metabolizing Enzymes and choose Add Metabolizing Enzyme. A new window is open. Here you can define metabolizing processes of your compound. First, you must define the specific enzyme responsible for the metabolism. In the drop-down menu of Metabolizing Enzyme, you can choose one of the enzymes which is already defined in the individual building block. Select CYP3A4. Enter a name, for example, in vitro, or the name of the publication. Choose process type that matches your data. You can either add Michaelis-Menten, first order, or Hill processes. Choose in vitro metabolic rate in the presence of recombinant CYPs enzymes Michaelis-Menten to add a Michaelis-Menten process. Enter a Km value of 2.73 micromole per liter for midazolam and click OK. In the menu bar Transport and Excretion, you can add transport proteins, renal clearance or biliary clearance processes. To define glomerular filtration, as they are active under physiological conditions, right-click on Renal Clearances and select Add Renal Clearances Process. In the new window, select Glomerular Filtration. A value of 1 is predefined for the GFR fraction and signifies passive filtration of the compound. A value greater than 1 means active secretion of the compound, and a value less than 1 means the compound is reabsorbed from the glomerular tubulus. Name the process Assumed. Click OK. Click Next. And click OK. The compound appears on the left side. If you right-click on the compound, you have different options. You can rename, clone your compound to create a compound with the same properties, or delete your compound. Many thanks for watching.